Ann Tuttle. I am an internist. I specialize in internal medicine, and I work at Virginia Mason in Bellevue. Internal medicine is general medicine for adults. I chose it for a variety of reasons, one of which is that I really like developing relationships with patients over time. I also like the mystery of medicine, so when someone comes to an internist, what they have could sometimes be anything, and that's less true when they're already narrowed down to a cardiologist or a specialist of some kind. The ones that we treat on an ongoing basis are sort of classic health problems that affect adults: high blood pressure, diabetes, asthma, menopause, but we really treat a little bit of everything. It's very satisfying when you feel like you've helped a patient reach a good endpoint, especially if they've been struggling. So that is why we all do it, is to get to that point. I think one of the most important things you can do is to listen to them, let them talk, and hear what they have to say, especially in internal medicine, where the items on their list of concerns aren't always why they're there. Sometimes the underlying problem is trouble at home or divorce or depression, where the list is a list of aches and pains, and you have to be able to hear all that. You have to hear what they have to say, and you have to be able to read between the lines. So I think in internal medicine there's a lot of listening that is important. When I'm not at work, I like reading. I often get recommendations from my patients from what they're reading when I come into the room. Recommendations, or they recommend against reading something if it wasn't very good. I like hiking, and I'm from the Pacific Northwest, and I enjoy exploring the outdoors. And I've recently taken up playing the guitar. So don't ask me how it's going, because it's not easy, but I'm enjoying it and trying to use my brain in any way.